Will a doctor perform mild congenital ptosis repair and epicanthoplasty simultaneously? I had blepharoplasty, Asian double eyelids, performed before. I do not like the droopy eyelid look. I believe tightening my eyelid muscle will raise my eyelid up. I have to consciously lift my eyelids, and when I lift my eyelids, my epicanthal folds stretch up and hide my inner corners. Photos when I am relaxed, not consciously lifting my eyelids.
Thank you for your question. You submitted a question requesting information about having your eyelid ptosis repair and combining it with epicanthoplasty. And the question also includes that you had a history of having had double eyelid surgery. So this is a type of question that certainly has different levels of information that is necessary to understand before moving forward. Well, first of all, in understanding ptosis, ptosis means drooping, and drooping of the eyelid in terms of its position relative to the center of the eye called the pupil. And so when we do ptosis surgery, very often it's a procedure that involves a muscle called the levator muscle. The levator muscle is like the word elevator, except without the letter E. So that muscle is a very sensitive muscle, and when we do ptosis surgery, we actually do the procedure in a way where we actually have some of the patient's cooperation for the most critical part, which is getting the right height, position, contour. And so that in itself has its own set of risks and benefits. One of the things that we always mention to our patients that although in a practice where I've been doing this for over 20 years, I still have the occasional patient that needs enhancement, whether it's the eyelid being too low, too high. It's a very sensitive muscle, and you just need to be prepared for that contingency or that result so that you are prepared for a second or third procedure if necessary. Now, when it comes to epicanthoplasty, I know that there is no real uniform opinion about epicanthoplasty. Epicanthoplasty means that essentially the epicanthal fold, which almost defines a significant part of the Asian eyelid anatomy, sometimes people want to have that fold reduced to make the eyes look a little bit more they look too close together, and they want to make the eyes look wider apart, and to just make the eyes look overall more open. The thing about epicanthoplasty is that you have to understand that the procedure, even when done in experienced hands, it is still several very small incisions in the inner corner skin of the epicanthal fold. Now, when photos are taken of before and afters, it can look very good. But the concern I always have with every patient is the possibility of some type of scarring that, even if it's flat, might be visually perceptible. So that requires an evaluation of skin quality and a discussion about the predictability of that procedure and what kind of scars you're willing to accept. So although there are many procedures that can be combined with ptosis surgery, including epicanthoplasty, you really need a physical exam to get an opinion that will be of any value. So to answer your question, it's possible to do both ptosis surgery and epicanthoplasty simultaneously, understanding the different variables and the way a person may need enhancement if you were to have this type of surgery. And my recommendation is meet with specialists who do a lot of Asian eyelid surgery, and when you get to the ptosis realm, you're really dealing more with oculoplastic or oculofacial plastic surgeons, as well as who have experience with epicanthoplasty. And physical exam will make is a very important part of this decision-making process. So I hope that was helpful. I wish you the best of luck, and thank you for your question.